From Diamond Pharmacy Services, this is PodcastRx, a monthly show that takes you behind the counter of the nation's largest correctional pharmacy provider. We bring you conversations with pharmacists, nurses, managers, and other Diamond staff about the topics and issues we see in corrections, long-term care, and community health settings. Our chats aren't limited to purely pharmacy topics, and they aren't strictly clinical either. So if you're a healthcare provider or just enjoy healthcare podcasts, we think you'll enjoy this show. On this episode, our very own Dr. Deborah Milito returns to talk her big election win as president-elect of the American Society of Consultant Pharmacists. We talk about Deborah's history with the ASCP and senior care pharmacy, the many professional opportunities ASCP provides pharmacists, and a few of Deborah's visions for the presidency. And we also take a brief digression to discuss the recent FDA authorization allowing pharmacists to prescribe Paxlovid for COVID-19 patients. All this and more on PodcastRx. I'm Adam Campbell. It's so great to welcome back to the show one of our frequent contributors, Dr. Deborah Milito. She is, of course, the Director of Skilled and Consultant Services for our Long-Term Care Division, as well as the Chief Antimicrobial Stewardship Officer for Diamond. Naturally, she's been on many times to discuss matters of clinical importance, but today we're taking a break from that to talk about a big professional milestone that she recently achieved. In May, Deborah won President-elect of the American Society of Consultant Pharmacists. We've talked about her involvement with ASCP many times on past appearances, but given this big win, I wanted to dive a little deeper on the topic. So, Deborah, thanks again for being on PodcastRx, and allow me to congratulate you on your big election win.
Thanks so much, Adam. It means a lot to me.
No doubt. And that leads to my first question. This winning the presidency, the president-elect, it's no doubt the culmination of a long involvement with ASCP. And I was curious, just how long have you been involved with this organization?
I started being a member about 17 years ago, and it was at the state level of Pennsylvania. And I was a volunteer, and then I became a director on the board for the state chapter. And then I started to volunteer with some different committees at the national level. And then I got to be on the board. And now I'm in my second term of being on the board. And then I became president-elect.
That's excellent. And what's the rough timeline in the first from just being a member to doing your first assignment beyond just being a member, from when you joined to when you started climbing the ladder, so to speak? How long was that?
Well, I would say around 5 years, because I started to get involved with the Antimicrobial Stewardship and Infection Prevention and Control Committee as a volunteer at the national level. And then I became the chair of that committee, and I remain the chair of that committee. And it's just, there's so many different opportunities to join different committees. So just about anybody that has an interest in advocacy or transitions of care or opioids, anything like that, you pretty much will find a home for being a participant in one of the committees.
For you, what lit the spark to look at ASCP and go, I want to be in that organization?
Well, I worked in a small acute care community hospital for 20 plus years. And I really was exposed to a lot of different areas of where I could contribute. It was a geriatric psych unit that we had. We had a child and adolescent psych unit. And I did find myself liking those two different topics. But, there were so many others, but the geriatric one sort of stayed with me. And then when I came to Diamond Pharmacy Services, we sort of needed somebody in the arena of the long-term care. And so I started out as being a consultant, and then I became the director of the clinical and consultant services for our long-term care division here at Diamond. At that point, I thought that joining an organization that takes care of seniors like the American Society of Consultant Pharmacists would be a good landing place for me.
Remind me how long you've been with Diamond.
17 years.
17 years. Okay. Yeah. So that lines up neatly with the ASCP.
It does.
Very good. I think that's terrific that you found your calling through that and were able to further ply your trade that way. I want to ask, how has your involvement overall with ASCP enriched and enhanced your career as a pharmacist?
there's so many ways, but I would say the first that I would like to talk about would be the connections that I've made with people throughout the United States. And ASCP does have participation in other countries as well. But I've made so many connections with so many different colleagues that a lot of them I call my friends and close friends that I would have never known if I wouldn't have been a member of ASCP. So I think that's probably the most important to me are the friendships and connections that I've made.
And that's what's most important with most things in life, I would say. And you alluded to this, but you've worked in all areas of pharmacy. We've worked in retail. You've worked in that acute care hospital. But overall, senior care pharmacy is where you found your heart to be. What do you enjoy most about the senior care pharmacy profession?
Well, first of all, we do have the graying of America going on right now. We've never had so many people over the age of 65. And that's only going to increase as time goes on. And so we need more and more practitioners that will help to take care of our seniors and to help them to stay in place, to stay at home as long as possible. Most seniors would like to age in place and not be moved to another location. But we as pharmacists, whether we're pharmacists working in a long-term care pharmacy, or we're pharmacists working in the retail setting, or we're pharmacists teaching, all of us play a role in taking care of the seniors, not only now, but into the future. So we would really want to promote students knowing about these different opportunities as well.
I'm glad you mentioned students because in your campaign video for president of ASCP, you talked about negative perceptions that were out there of pharmacy, particularly among high school students. Before they even get to thinking about pharmacy as a profession, I'm sure. And I was curious, I wanted to learn a little more about that. What exact negative reactions were you seeing or have you heard about? And what's your response as now you're in a position to address that, more directly now, being the head of ASCP? What were the reactions you were hearing, and what's your response to that?
So it really saddens me to see different posts on various social platforms. I know that from a retail perspective, it's a tough job, and there are a lot of metrics that are measured by corporate entities, but it just seems that there's a lot of negativity from maybe that arena the most that I've seen, that high school students are reading that, or counselors are reading those too, and almost telling the students, I don't know if you want to go into the pharmacy profession. It seems like there's very long hours and the pharmacists aren't very happy. Well, I'm here to say that I'm very happy in what I do, and I would just like to hear more positivity surrounding the pharmacy profession. And it's such an exciting time for us right now that we stepped up during COVID, and it went to show a lot of people everything a pharmacist really can do. I don't know that everyone knew all the things that we could do, such as immunizing and counseling and helping people with testing. These are things that came out in the last 2.5 years. So not all things with COVID were bad. These were positive things that did happen with the pandemic.
Presented many opportunities to show, again, the importance and contribution of pharmacists in the overall healthcare scheme, for sure. Continuing, though, with students, you talked about high school students, particularly there, but you also do a lot of work with student pharmacists at local universities, Duquesne and Pitt primarily. And so there you actually get to work directly with students who are already studying pharmacy, and you get to show exactly what's going on there. And I wanted to learn more about that. I know that was also part of your campaign video as well, just how important student outreach and advocacy was. And I also, as a complete lay person, I don't know what a preceptor is, and I'd like you to explain that to me too.
Okay, so one of the topics that I really like to do is to actually go to the universities. And both Pitt and Duquesne have student ASCP chapters. And they invite me to go, and they want to hear about my career path from beginning to end. And it's always very interesting to them learning how someone has gone from pharmacy school to graduation to everything in between until, where I am these days. So I would say that if any pharmacist that's listening to this ever has the opportunity to go to a university and speak to the student chapters there, do it. It's very gratifying, and the students just love it. And to answer your question about what is a preceptor, so I'm a preceptor for Pharm D students at both universities, and they can either come here to Diamond and do an introductory rotation, which is only about 3 weeks. And that's just sort of learning the ropes very generically at that point. And then the second type of rotation is called an advanced practice or an API rotation. And that's 5 weeks. And they pretty much do everything I do. They shadow me. They go to different meetings that I go to. If I have presentations, they go with me to consulting. They present a topic. Maybe they read an article and then present that. So it's everything that we can possibly fit into 5 weeks. And
no doubt they're getting exposed to so many important areas, and you're making the most of that 5 weeks.
Yeah, not only do they spend time with me, but I have them spend some time in the IV department, sit with the data entry technicians, go to, infection prevention and control. I really try to make it a varied rotation when they're here.
And I would assume that while they're here, you're talking with them. You're talking with them about what exactly you're doing, but you're also spreading the gospel of senior care as a path that they could choose. So are you seeing a lot of these students, well, not just the ones you work with, but seeing more students in general pursuing that path that you talked about?
Yes and no. I think a lot of students do accept positions in retail pharmacies upon graduation. But what I would say to these students is that you're going to be taking care of seniors no matter where you are. Mm-hmm. So it might be a good place to start. And, you do have an ability to counsel seniors as you would for other patients too. But you might find that as your career progresses, that you want to focus on more of senior care practice. And that's when you can start to think about maybe getting into consulting at a different long-term care pharmacy.
And as you already noted, the demand is just going to expand greatly for the amount of seniors that we're going to see and already see in the population. I wanted to go back to your election win again here. And when does your term begin? When are you president, no longer president-elect?
So the way it works is at our annual meeting in November, which happens to be in San Antonio, that's when I officially become president-elect. And I spend the year with the current president and pretty much learn the ropes from her and attend different meetings and things like that. And then the following November, so now we're talking November of 23, we'll be in Orlando for our annual meeting. And that is when I'll be installed as the president. And then the following November in 24, it will be in Denver. I will become chairman of the board.
That's a lot going on in the next few years.
Yes,
you know where you're going to be.
It's a 3-year commitment. Yes.
That's great. That's great. And I have to ask, when all is all is settled, what is your first official order of business? Have you thought that far ahead yet?
Oh, that's a good question. Well, I would say that I just want to meet more people across the United States, and maybe even the other countries like Australia and Canada. We have chapters there. So it's just such a wonderful experience when I can be talking to an ASCP member and they ask me a question, and I can easily say, oh, I know the person that I need to connect you with to get the best answer for that. And that's only from talking and doing presentations at so many different states for ASCP in the last 17 years that I just want more of that.
Yeah. The networking, the connections.
Yes.
Would you say do you have an all-time favorite ASCP memory now with 17 years involvement with the organization? Is there one particular moment or conference, presentation, any of that connection that stands out the most to you?
Well, at each of the annual meetings, the Saturday night party has a theme. And so I think it was 3 years ago. It was peace, love, and I don't know, there was something else thrown in there.
Understanding, maybe?
Peace, love, and understanding. And we got to dress up like, the 70s, and that really was a lot of fun. Not only with some of the members, but certainly some of the ASCP staff members really got into it. So that's a good memory. And most of the Saturday night get-togethers, people literally can let their hair down a bit, and and we have a little bit of fun. So that kind of makes a good memory for me.
How about other goals as president? Of course, you want to address those perceptions of young people. You want to make pharmacy a profession that young people want to pursue, and you also want to connect more with people. But what other larger scale goals for ASCP as an organization do you have in mind?
Well, I think one of the best ways that I can help to grow ASCP is to learn about what other organizations are doing. So I will have the opportunity to attend meetings from different organizations and be able to bring some of that back to ASCP. Most recently, I was invited to attend the AACP meeting, which is the Colleges of Pharmacy, and talked about like a new way of learning going forward that might have more to do with, instead of continuing education credits, it would be competencies, which would mirror medical school experiences. So I found that to be very interesting, but there were several of us that attended across the country, and it was simultaneously we could all participate, and it was very interesting. So I would like to do more of that.
Yeah, more incorporating other organizational elements into ASCP. I've just been following, generally ASCP, definitely with my connection with you, but also seeing like on social media, LinkedIn in particular. In the last few years, the organization is rebranded, has that nice little butterfly icon, and really putting the senior care focus up front. So it's no doubt it's an exciting time for you to be where you are in the organization with that renewed focus.
Yes, I feel very good about where ASCP is. Chad Wars, as our executive director, has really done such a great job. And I'm really looking forward to working with not only him, but the rest of the staff.
Well, Deborah, I certainly want to congratulate you again on that win and wish you much luck and a lot of great experiences moving forward in your 3-year commitment. And that's going to be great. And it's also great for Diamond to have the head of an organization like ASCP, the president here working with us. And that's great, great for you, great for the company as well. So congratulations once again. Given your work with vaccines and COVID and things we've talked about on this show before, I wanted to get your reaction to the news that broke recently, July 6th, as this show being recorded on July 18th, that the FDA revised the emergency use authorization for the antiviral treatment Paxlovid, which we talked about on PodcastRx, episode 26 with Chris Bender. if you want to check that out. This revised EUA now allows state licensed pharmacists to provide Paxlovid for eligible patients with a few caveats. But all things considered, what do you think are the biggest benefits for pharmacists and patients in the aftermath of this EUA revision?
I'm thrilled. We've been waiting for this for a long time. I can only hope that all pharmacists embrace this opportunity. We can finally prescribe a medication. I know that there's some hesitancy with some pharmacists. They're thinking that maybe they won't have all the information that they need to do it safely, but a patient can bring their lab results from the past 12 months, and you can look at their renal function and hepatic function, and then hopefully the patient only goes to your pharmacy, so you have a complete list of their medications prescribed and over the counter, and then you'll be able to evaluate the drug-drug interactions. And if you have all that information, then you can prescribe the Paxlovid based on a positive COVID test. Now, for those instances where you don't have that information, you can either contact the provider that patient goes to, or if you need to, you can refer the patient back to the provider if you're not feeling comfortable because you don't have all the current information. So again, it is such an opportunity. It's getting us one step closer to achieving provider status. And in my lifetime, and as I'm president at ASCP, I certainly hope that happens.
What do you feel like the probability is of it happening while you're president? How much, if not outright happening, full provider status, how close do you think you're going to get?
Well, we're getting closer every day, and we have 2 pharmacists that are in Congress, I believe, not the Senate, and that's unheard of. We're so happy we have 2 pharmacists. Mm-hmm. So there are different bills that are being floated around, and we're very hopeful. And I will tell you that ASCP, our advocacy group with Arnie Clayman and Jim Lewis, they are pounding the pavement and doing everything they can to keep this moving forward. So I am very hopeful.
Yeah, well, we're very hopeful too. I just want to thank you again for taking the time to talk a little bit about your new involvement with ASCP. And we're really thrilled for you, Deborah. And we, again, wish you great success moving forward. And we're going to be having you back on the show again for more clinical stuff and probably more ASCP stuff. So hope you're ready.
I'm ready. Thanks, Adam.
All right. Thank you. This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.